The Pentagon is at war with Oklahoma's National Guard over compulsory vaccines. It's threatening disciplinary action if guardsmen skip their jabs, and their commander openly flouted the order.
It is a lawful order for National Guardsmen to receive the COVID vaccine. It is a lawful order. Refusing to do that, absent of an approved exemption, puts them in the same potential as active duty members who refuse the vaccine.
In mid-September, US Defense Secretary Lloyd Austin announced all uniformed personnel would have to get vaccinated. However, the newly appointed commander of Oklahoma's National Guard said he'd turn a blind eye to non-compliance among his troops.
I hereby order that no Oklahoma guardsman be required to take the COVID-19 vaccine, notwithstanding any other federal requirement. Additionally, no negative administration or legal action will be taken against guardsmen who refuse the vaccine.
We're joined now live by Cohen, who was the 2020 vice presidential candidate for the US Libertarian Party. Sir, thanks for joining us. Good to have you on today. This isn't the first refusal by essential workers effectively rebelling against mandatory jabs. We've seen it happen in other places now. Oklahoma's National Guard. Could this spread to other states among uniformed personnel, among other essential workers?
It's likely to spread to other states, especially now with the federal courts holding up one of the vaccine mandates, and many state governments already suing the Biden administration and OSHA against that. This is a little different because it's for federally employed National Guardsmen, but I think we're seeing an increased and mounting resistance across the board.
Do you expect many of National Guards to walk out if the Pentagon doubles down on that jab order?
I do, and we're already seeing that anecdotally and in data. And the interesting thing about this is that we were told that the reason for the need for this vaccine mandate for the military was for troop readiness. COVID has a 0.02% fatality rate among active duty and National Reserve, among the troops. And the reality is it's probably much lower than that because there are plenty of troops who get it and never even know they had COVID and never got tested. So if even 1% walk out or retire early as a result of this mandate, then you're likely to see anywhere from 50 to 100 times more of an impact on troop readiness than from the virus itself. And that assumes that that anyone who's vaccinated wouldn't die of COVID, which does happen, and that there weren't any adverse reactions to the vaccine, which of course happens as well. This is just bad policy.
If there is a walkout of the National Guard, how would that affect security on a national level? Say there was a situation like the one we saw on Capitol Hill, the riot, for example. How would that be dealt with? And on a wider level, I suppose, if that spreads to emergency personnel in uniform, how would that impact services on a federal level?
Well, that's the question, right? We're seeing in some police departments that as many as 40% of police and other first responders are refusing to take the vaccine. I suspect the numbers are lower among the troops, but it's probably not that much lower. And these are the kinds of things, that the Biden administration needs to think about when they're deciding to try to shove these vaccines down the throats of people who don't want them. And these are the people, when you're talking about first responders, people in the military, the people that are in the labor pool, these are the people that are the least likely to die of COVID. So there's not really a good argument, even from a saving lives standpoint. There's no good argument for this. It isn't a good idea anyway because it's imposing on everyone's lives and rights. But it isn't even doing anything to actually stop or slow the spread of COVID or even prevent that many deaths.
I don't know if you saw the report that was on just before our interview, the protests in Australia currently happening because of vaccine mandates there. But not only in the US, across the world, it's really exacerbating divisions in society between states and institutions, individuals. Where do you see this leading in the coming months as we lead up to the winter season?
It's not just exposing division, it's exposing a truth that governments don't want you to know, which is that their power isn't real. All that there really is what the people are willing to tolerate. And if even a small percentage refuse to comply with something, the ability for government to be able to effectively enforce whatever that thing is basically goes away, leading to more people saying, well, if they don't have to do it, then I'm not going to do it either. And that leads to government having to cede trying to enforce that in order to not betray the fact that they don't have any real power. So I hope that we see mass non-compliance for all of these COVID regime orders, and that leads to governments having to back off of this and realize this was never a good idea. It's not saving lives. It's ruining people's lives and livelihoods. COVID isn't going away, and we need to rethink how we're going to live the rest of our lives.
I suppose you raise a key question there, which is rethinking how we're going to deal with this, because obviously I think that the evidence is there that vaccines are helping to save lives. Otherwise, there'd be a massive rise in deaths alongside the rise in cases, obviously. But if vaccines, of course, are not made mandatory, even if most people do take them, how will the US and other countries, Russia, the UK, Australia, beat the pandemic then when deaths are on the rise in some countries?
This isn't a pandemic. COVID waves are not going away. This is going to be as permanent as cold and flu season. Until they have a way to completely cure us of respiratory illness, this is not going away. And so we need to ask, are we going to, for the rest of our lives, mandate that people who are the least likely to die from COVID, in order to be able to go outside, in order to be able to live their lives, in order to be able to work, that they have to get booster shots for the rest of their lives, even though they can still get and spread COVID, on the off chance that it might also save their life, even though they're the most likely to survive COVID or not even know that they had COVID in the first place. And I think as more and more people realize COVID is not a pandemic, it is endemic. It's not going away. More and more people are waking up to realizing they don't want to live like this forever. This is not a temporary thing. It's not going away, and we don't want to live like this.
What is the answer to these waves then, in your eyes? If this is something we're permanently going to have to live with, I mean, presumably you're against mask mandates and things like that as well. If vaccines perhaps are not the answer, though, as I say, the scientific evidence is there that they are saving lives and keeping people safe, would you argue against all mandates, from social distancing to masks? I mean, how do we get out of these waves then, as you call them?
I don't know that there's a way to get out of them. And we know that the lockdowns didn't work. We know that the mandates aren't working to stop the spread of COVID. We know that the vaccines are effective in stopping those who are the most likely to die from dying of COVID. And it is likely that those are also the people who are the most likely to want to get vaccinated. But that's a different question as to people my age and your age who are almost guaranteed to survive or have a very mild case of COVID, telling them that they have to live their lives this way. I think that when you look at the devastation that has been caused, not just to lives and livelihoods, to the supply chain, to the labor pool, with the government trying to play red light, green light with society around the world, I think we have to really weigh the public health measures related to COVID to literally everything else in our society. And I think once you do that, you realize that there's an aspect of this that isn't going away no matter what is done, and that these things aren't helping, and that this impulse to say, well, government has to do something, if that thing isn't helping, and if all it's doing is causing other ancillary damage as a result of it, then we need to be looking at what actually does help. And more often than not, that's increasing the access to healthcare by deregulation and getting rid of the regulations that are making access to healthcare so hard. And then looking at the fact that disease kills people, and that's not going to stop as a result of government action.
Yeah, it certainly raises a lot of questions about where the next year is going, as well as we enter a third wave of this global challenge. Spike Cohen, 2020 Vice Presidential Candidate, Libertarian Party. Thanks so much for your take here on that story on RT International.
Thank you.